We are still seeing face-to-face appointments. We've never stopped seeing face-to-face appointments. We're speaking on the telephone when it's appropriate, but sometimes when we speak to people on the telephone, we need to bring them down to be seen face-to-face.
Before the pandemic, there was a real push to start with opening up digital offer. There were different private companies offering online consultations. We wanted to offer that as well because we know that there's a certain cohort of patients that really needed to be able to access us from work or in the evenings and weekends, and we could respond back with either a text message or a phone call or a prescription or treatment. And they didn't really want to speak to us because they didn't need to speak to us, and they could also send a picture if needed about their problem. COVID came along and we accelerated that, so overnight we switched that on, and then that also increased demand. Now people can pick up their phone or any type of device at any time of day, fill out their health problems, and it pings an email straight to our system, and then we are then obliged to have a look at it and respond back within 48 hours.
Yeah, so the reason we're asking questions is just to try and help you and place you with the right person. So if you were to ring up with a query that's mental health related, we have mental health practitioners in the surgery, and she's probably better placed to speak with than a GP, not only because she specialises in mental health, but her appointments are longer than the GP, so you've got more time to discuss your worries and discuss your queries, and it's just to kind of make sure you are seeing the right person.
We're asking them to ask certain questions so that we can navigate you as a patient to the right person. Because if you've got your medication query, then the receptionist can navigate you to the pharmacy appointments, and it might be more appropriate for that to be on the telephone rather than a face-to-face appointment, and that might be more convenient for you if you need your medicines reviewing and you're at work. And equally, if you speak to the receptionist and you've got a problem with a joint, then she might navigate you towards our musculoskeletal practitioner. Or if you've got some problems with benefits or housing, she might suggest that maybe you don't need to come into the practice to see one of the professionals here, but she might give a referral to one of our social prescribers who can support a bit more wider in the community and involve the voluntary sector. So there's loads of different avenues to get help within primary care. It's not all just seeing the doctor.
So my role hasn't really changed during the pandemic. There was a week or so maybe at the beginning just while we kind of worked out safe ways of working and had all the relevant equipment. And then I've been out and about visiting throughout. That's never stopped. So any patients who've needed home visits have still had them.
So across the board, I think all my GP friends, doctors everywhere are really struggling. I understand that A&E are struggling with the demand from patients. And I think there's sometimes that feeling that GPs aren't doing their bit to try and reduce the workload for A&E. But I can promise you from my experience, we are trying extremely hard to try and keep people out of hospital. We're working 12, 13-hour days. We're still calling patients at 8, 9 o'clock at night. There's just not enough hours in the day to meet patients' expectations, really.